Hi folks, let's talk about so-called morning sickness. So in fact, the term morning sickness is misnomer. Very misnomer. While nausea and vomiting are often more pronounced in the morning, when we talk about pregnancy of course, they can occur at any time of day at night. Some women experience symptoms through the entire day. So clinical importance of that, my beloved students. And you will ask about that on a big exam, board exams. Understanding this helps patients feel validated. Understanding this helps patients feel validated. Don't dismiss their symptoms just because they occur, I don't know, in the afternoon or evening. It affects how you counsel them about symptoms management strategies. For example, the most common, having snacks available at all times. And for me, why it's a very dangerous misnomer. So you have to understand, actually, you have to remember that maybe it will not be asked on the board exam, but you will remember in your future medical practice. Morning sickness, not morning sickness, nausea, it's not normal sign at all, period. Early pregnancy, not early pregnancy, this is a sign of toxicity. Of course, not very severe toxicity, no, it depends. But anyway, normal pregnancy goes without any morning, so-called morning sickness, evening sickness, without any nausea, and I don't talk about vomiting. In all conditions, nausea, pregnancy, not pregnancy, doesn't matter. It's a sign of toxicity. Remember that. You might not answer in this manner, of course, on the board exam, but remember, nausea is a not normal, period. Then, time is a key of morning sickness, of course. Peak and resolution. So this morning sickness typically begins around the 6th week of gestation, peaks around the 9th week, and usually resolves by 12th, 16th week, due to placenta might be. However, in some cases it can persist throughout the pregnancy, and I repeat, especially if it persists, it's a sign of toxicity. Remember that. It's not normal. What is clinical issue of that? Knowing the typical timeline, so around the 9th peak around, begins at 6th week of gestation and around the 9th week's peak, and resolves usually by 12, 16 weeks. So knowing the typical timeline helps differentiate so-called normal morning sickness from other conditions causing nausea and vomiting in pregnancies. I repeat, there is no normal morning sickness, period. So it provides a basis for reassurance during routine prenatal visits and a benchmark for when to consider alternative diagnosis if symptoms persist or worsen. Persistent vomiting can indicate hyperemesis gravidarum. So hormonal culprits. The exact cause of this nausea in early pregnancy, so-called morning sickness, isn't fully understood. But hormonal changes are strongly implicated. Rising levels of human chorionic gonadotropin, HCG, and estrogen are believed to play a significant role. Changes in progesterone levels may also contribute by slowing gastric emptying. Actually, it's speculation, but anyway, you might answer in this manner that hormonal changes are strongly implicated, especially human chorionic gonadotropin and estrogen are believed to play a significant role. So, what is clinical issue? This informs treatment. Treatment strategies. While we can't directly lower, of course, human chorionic gonadotropin (HCG) or estrogen, understanding their role highlights the importance of managing symptoms related to their effects No, for example, by addressing delayed gastric emptying with small, frequent meals. Actually, it works. It does work, yeah. It also explains why women pregnant with multiples made higher HCG often experience more severe morning sickness. But believe me, it's a speculation. Now about hyperemesis gravidarum, so beyond normal morning sickness. Hyperemesis gravidarum, HG, is a severe form of morning sickness characterized by unstable vomiting, dehydration, electrolyte imbalance, weight loss, more than 5% of pre-pregnancy weight, and ketonuria. So there is no obvious border between normal morning sickness and hyperemesis gravidarum. That is clinical importance. So distinguishing hyperemesis gravidarum. So sometimes we use just acronym HG. Not me, thanks God I'm not a gynecologist. So distinguishing HG from normal morning sickness is critical. This hyperemesis gravidarum requires prompt medical intervention, including intravenous fluids, electrolyte replacement, electrolytes, antiemetics, and nutritional support. Unrelated HG, hyperemesis gravidarum, can lead to serious complications for both the mother and the fetus. Always assess for signs of dehydration, tachycardia, orthostatic hypotension, decreased urine output, and other appropriate labs, electrolytes, ketones, liver function tests, and so on. About dietary strategies, so a first line of defense. So for some simple dietary modifications can often provide significant relief. Don't be immediately starts with medications. These include eating small, frequent meals, avoiding strong smelling or very fatty foods, consuming bland, easily digestible foods. No, I don't know. Rice, for example, toast, and little crackers, not fast food, of course, and separating liquids from solids. No, it depends, of course. What is clinical issue of that? Educating patients about strategies, it's a cornerstone of managing morning sickness. Provide specific examples and encourage them, my beloveds, to experiment, to identify triggers and foods that they can tolerate. So advise them to eat before they feel hungry, to prevent an empty stomach from exacerbation nausea. Actually, about ginger. Yes, it works perfectly. Power of ginger has been shown to be effective in reducing nausea and vomiting in pregnancy. It can be consumed in various forms, such as, ginger ale, ginger candies, ginger tea, or ginger capsules. Actually, why it does work, no idea. Well, a lot of speculation, but anyway, clinical importance of that. Ginger is a safe and reliable, available option for readily ginger. In every magazine, every shop you can find, market, you can find this ginger. It's a safe and readily available option for managing mild to moderate morning sickness. Recommended, it's a first-line treatment. Advise patients to check the concentration of ginger in supplements to ensure they are taking appropriate dose. Typically 1 gram per day, maybe more, divided into multiple doses. It depends. It depends how you tolerate. Not you, my beloved students, pregnant women. So about vitamins. B6, pyridoxine, safe and effective option, pyridoxine. Vitamin B6, yes, pyridoxine is another safe and effective treatment for morning sickness. It's often used alone or sometimes in combination with antihistamine doxylamine. So, my beloveds, clinical importance of that vitamin B6 is a well-established treatment option with minimal side effects, with no side effects, we can say. Recommended dose 10 up to 25 milligram 3 to 4 times daily. And this combination of doxylamine and pyridoxine, so combination of doxylamine and pyridoxine, what's the name? Dihydration, yes. Dihydration is a prescription medication specifically approved for morning sickness, and works good. But don't forget to rule out other causes. So it's crucial to rule out other potential causes of nausea and vomiting in pregnancy, such as gastroenteritis, pyelonephritis, cholecystitis, appendicitis, molar pregnancy, and thyroid disorders. So, but I repeat, my beloveds, remember for all your life, there is no normal morning sickness. Of course, it's not a catastrophe, but anyway, it's a sign of toxicity. My strong opinion, it's problem of kidney. So that's why you have to explain that drinking no water in normal quantities and qualities, it's a very good advice. So about clinical importance, always obtain a thorough history and physical exam. Always obtain a thorough history and physical exam. Actually, it's a good advice for any other pathological conditions. Consider ordering lab test, electrolyte, CBC, liver function tests, amylase, lipase with pancreas, urinalysis and imaging studies, for example, ultrasound, in the symptoms, if the symptoms are atypical, severe, or accompanied by other concerning signs or symptoms. For example, abdominal pain, jaundice, fever, oh God forbid. Don't automatically attribute all nausea and vomiting in pregnancy to morning sickness. Once, the third, fourth time, I repeat it to you, there is no normal morning sickness, my opinion. So what is clinical takeaways, my beloveds, for you, my dear students? I actually am doctors, why not? So empathy and validation, and acknowledge the patient's distress and validate their experience. So comprehensive assessment, differentiate between normal morning sickness and hyperemesis gravidarum. Hyperemesis gravidarum, up to you how to pronounce that. Assess for dehydration, electrolyte imbalances, and other complications. Graduate approach to treatment. Start with dietary modifications, lifestyle changes. Then consider, why not, ginger, vitamin B6, doxylamine, and other antiemetics as needed. Actually, why not physical activity? Walking before going to bed at night. Walking. 5,000-7,000 steps a day. Very good. Advice, if gynecologists, if not against that. Education and support, yes. Provide patients with clear and concise information about morning sickness, treatment options, and warning signs, and warrant medical attention. We have to rule out other diagnoses, always consider and exclude other potential causes of nausea and vomiting, and individualized management. Tailor the treatment plan to the patient's individual needs and preferences. So I suppose, I'm absolutely sure if you answer like this, in this manner, on your big board exams in gynecology, obstetrics and gynecology, you will have your excellent mark and will pass successfully. God bless you. So, thanks for your attention, my beloveds. Don't forget to follow and subscribe my Dr. Y YouTube channel, and don't forget to follow and subscribe my Telegram private Dr. Y channel. How to find this Dr. Y private Telegram channel? Easy peasy. Just type in searching mode in Telegram Dr. Y like question. Dr. Y, it's me. Dr. WHY. Without question mark, of course. You click start and you choose your plan. You will find a lot of MCQ tests, oral exam tests, exams, how to... actually, MCQ test is a question, answer, and explanation, each question. Gynecology, obstetrics, surgery, internal medicine, and so on. God bless you. See you on my Telegram Dr. Y channel. Bye-bye.